The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to The 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hey, Sylvia. Hannah here.
Hey, Hannah. How's it going?
It's going all right. We're talking about outbreaks today. The title of today's episode is Don't Panic. Not sure for anybody that's not familiar with that. Hitchhiker's Guide to the Galaxy is probably one of my favorite movies or book series. Always remember, bring your towel. Ironically, though, towels are not the most healthy when it comes to infection prevention.
Super excited to talk about outbreaks today. I think our listeners are going to get a kick out of it. It's going to be super informative.
We're going to talk about outbreaks in more detail today with some great folks from Arlington County, Virginia. We've got Lisa Guli and Evelyn Poppell. And so they are from the Arlington County Public Health. So they're going to chat with us a little bit more about outbreaks. And I think people are just, when they think of outbreaks, they think of movies. They think of zombies and they think of diseases spreading across the world.
Yeah. And I think they're gonna tell us more about not just outbreaks, but, we hear things like pandemic and epidemic. And so today, to just educate a lot of you on what that really means. And keep in mind that most of the time we're just living our lives, going to work, doing our thing, and everything is hunky-dory. Outbreaks do happen, but we got to give a huge shout out to the infection preventionists out there because most of the time things are just humming along. They're doing their job and keeping us safe, and so we're just gonna touch on what can happen and educate some of you. So yeah, it's exciting and hope you'll be prepared.
So let's bring in Lisa and Evelyn. So welcome all. Lisa, you are the public health epidemiologist for Arlington County, Virginia, and Evelyn, you are the bureau chief. So we, typically we speak to infection preventionists within the facility. So let's get a sense of sort of what do those public health professionals do? And I know, Evelyn, you also have a background in infection prevention and control. So right. Would love to get a sense of what your role is in that patient safety and public health space.
I like to think, and thank you, first of all, for letting us be here. This is a great opportunity. I'd like to think that infection control work is exactly like it is in the hospital. In the hospital, however, you're focused on a patient, an individual patient, and preventing spread of disease in that facility. But in public health, our patient is actually the community. Arlington, Virginia is actually 220,000 people that reside here, but there are more that work and play here.
Yeah, and we're just outside the nation's capital, by the way.
Exactly,
so for anybody
right.
who isn't quite sure where Arlington, Virginia is, we're just over the Potomac River.
Exactly.
And thank you, Evelyn, for explaining that, because I think that's a really great way of describing our work in public health, because it coordinates really well with the IPs in the hospital. The IPs are overseeing persons who may have, and obviously I'm focused on infectious disease, so I'm going to make that my example. So an IP might be looking at someone with a diagnosis of an infectious disease in a hospital, and their work is to protect the other staff members, the other persons who are at that hospital for entirely other reasons, from contracting an infectious disease, whether it's that person's or someone else's. Our role is similar in that we identify persons with what we call reportable diseases, so infectious diseases that are actually reportable by law from a physician or from a hospital to local public health or to the state. And we follow up on those. And our job is then to protect the public's health as if they are the rest of the members of the hospital. For an IP, we're protecting the rest of the community.
Okay, so what keeps coming to mind is we're all, again, we're on the metro, we're going to work, we're going to school, we're hanging out with our friends and family, and you all are sort of our angels, or the folks like the police almost, keeping us safe from crime. You're keeping us safe from disease as a community.
Or healthcare watchdogs.
That's it.
Potentially, does that sound about right?
I like to think of us as the silent partners. When you go to a restaurant or when you go to a swimming pool, you don't think you're going to get sick. You go and you plan on having a good time or a great meal, and the last thing on your mind is getting sick. We in public health are those silent partners, and we are in the background doing preventive things that keep the public safe.
Now, Lisa, when you were talking about just now at public health, this has to be reported by law. I mean, that's some pretty heavy stuff. I mean, so, going into the difference between outbreaks, pandemics, epidemics, let's go into that a little bit.
Sure.
What's the difference between, those three different things?
Sure. I'm going to start at the lowest level, which is those reportable diseases that I mentioned. So CDC has a list. This is the Centers for Disease Control and Prevention in Atlanta, has a list of what they call notifiable diseases. They try and count these diseases as they occur in the United States. And they get that information from the states themselves. And it all really feeds up from the local level because each state, as far as I know, and I know Virginia does, has a reportable disease list, which means that when there's a highly suspected or diagnosed condition on that list, physicians and laboratories and all the people in that medical network are required by law to tell local public health wherever they're located in the state. Aside from that, and we do investigations of differing levels for each of those.
And Lisa, just quick question. So you go to the doctor thinks you have a notifiable disease. Does it have to be confirmed, or even if he just thinks, oh my God, I think this person...
If he strongly suspects it, especially for some that are what we call rapidly reportable, so they need to be notified upon strong suspicion before they're diagnosed, because then we can really jump on any need to prevent a spread of that to other people. So if they're highly suspicious of it, they need to contact us. But also on that reportable disease list are outbreaks of any kind, not just of those conditions. So, for example, norovirus. Everyone hears about norovirus on the cruise ships and norovirus in offices and things like that. Norovirus. Schools, absolutely. We do react to those outbreaks and follow those as well, even though norovirus as an individual case is not on the reportable disease list.
So you have an individual disease that all by itself is potentially reportable. And then when you have more than you would expect of an illness, that's an outbreak. So it's not just one zombie. Maybe it's multiple zombies that we have that have something in common. And that's when we go into being the disease detectives, trying to figure it out.
So, and your first course in epidemiology always focuses on person, place, and time, and they drill that into your mind about when you're looking at diseases taking place in an outbreak. Do these persons involved have a time and place in common when you follow back that story? Or are they just what we call sporadic cases occurring that just are coincidental? And that's part of our job to figure that out. And then when you scale it up and you start having many, many more in a much more widely seen geographic area, they might call that an epidemic. To me, outbreak and epidemic is kind of the same. And then you have pandemic, which is mean it's more on a worldwide scale or on most of the continents and affecting people. And those are the more easily contractable things like influenza.
So something would, when I think of outbreaks or even epidemics or actually pandemics, not being in the public health space, is that Zika, is that Ebola because they were spreading, or was it because there were single cases that were moving to other countries? It's not necessarily a pandemic.
Exactly. So I think with Ebola, I would not call Ebola the outbreak from a few years ago. That was an outbreak. That was an epidemic of Ebola in West Africa. That was not a pandemic because those persons who were affected in other countries were associated with West Africa ultimately.
Right.
Okay. They were not. Cases. They were imported cases or very directly related to an imported case.
Okay.
So I was thinking, we heard that in 1918 there was a terrible influenza, the Spanish influenza, if my memory serves. And so in 2018 there was the centennial or the 100th anniversary of this horrific outbreak, pandemic,
That's right.
influenza that I think some estimates said it killed 50 million people, infected at the time a third of the population, blowing my mind. A third of the population.
Black Death,
Yeah.
Just
And what I found so fascinating about the Spanish flu of 1918, and you're right, it's 100 years, is that in Haskell County, Kansas, is where it's potential or alleged to have begun.
really.
The newspaper from that time was the Santa Fe Monitor, and they actually confirmed that something very odd was happening around that time. And they called people by name and they said, Mrs. Eva Van Alstine is sick with pneumonia, and Ralph Lindemann's quite sick, and Homer Moody has been quite sick. And they began to recognize that there was this cluster. And this very astute physician, while it was not a reportable disease at that time, called Public Health Service and said, something's going on in Haskell County. So that is actually very typical of the work that we do in public health. We are counting illness. We are recognizing clusters. We are tracking down those sick people and asking questions. And we want to know, what do the ill have in common? And we are connecting their stories. And when we do that, we're able then to say, okay, this suspicion that we had, we're able to begin to confirm it. So pandemic flu of that Spanish flu of 1918 is a great example of a pandemic and really exemplifies the work of public health.
Now, a lot of this really does rely heavily on people to report to you all, though. So, we say that our motto is infection prevention is everybody's business. If you
Yes.
see something, say something.
Yes.
And, that includes the IP's role in detection, especially when it comes to emergency preparedness. So let's talk about that a little bit more. So, for those individuals that work in the facility, especially, Evelyn, with your infection prevention and control background, what is your role inside the facility to report that? What does that process look like? Because I know some of these, we were talking about rapidly reporting, but I know there are other times where lab tests can take days. And so that's where that strong suspicion piece really comes in.
Protecting public health is really a systems issue. I mean, it's a systems approach. We in public health rely on our partners. We rely on laboratories, on physicians, on IPs in their facilities to call us and let us know that something's going on. But in the community, we're relying also on the EMS,
The emergency
medical system, right? Those medics that come in their ambulances to a long-term care facility and pick up one person that's ill might not be a big deal. But the next time they come out and they're picking up someone with exactly the same symptoms, we're going, whoa, what's going on? Do we have something, an outbreak, a cluster?
Right, looking for patterns.
Absolutely.
Exactly. And I think one thing that is incredibly important is, and I would say this for both the IP side and for those working in public health, is building those relationships before something happens in your community. Having, being on a first name basis with the IP, the infection preventionist at your hospitals in your local district, if you work in public health, is extremely important. If you're an IP, reach out to public health. Make them a partner who you collaborate with and communicate on a regular basis. Ask them questions when you need to. Just kind of, knock ideas around with them. And then later on, when something happens, you've got that relationship in place. There's that mutual trust, and it really helps.
So, Lisa, that's interesting because you all are from Arlington County, Virginia, public health. We obviously have doctors' offices, hospitals, nursing homes, all the different types of facilities. So once you hear about maybe something that's going on in the community, do you then report it to the state public health department and then it goes to the Centers for Disease Control? Maybe talk to our colleagues, our healthcare workers listening on maybe they don't know that process.
Sure, I can speak to what happens in Virginia, which is that Local public health receives those individual reports of illness, or we determine that there is an outbreak, and we do report that to the state, to the Virginia Department of Health. And that information does get sent to CDC. However, it gets sent anonymously, in numbers only. So any information we might receive about, say you go to the doctor and you had food poisoning, and they test you and you have salmonella, and we're going to call you, one of our nurses might call you, I might call you, and we'll have a whole conversation about what you might have been exposed to, where you traveled, all of that background information.
After I get out of the bathroom from feeling horrible.
And we do try and be considerate and say, do we need to call you back? That's okay.
Yes, please.
In the meantime, while you're not feeling well, think about, no, I'm just kidding. So we do get all of that information. We give information on how they can prevent it from being passed on to anyone else and their loved ones, their friends, when they should go back to work, if their work is high risk. So if somebody's ill with one of these, we don't want them to go provide health care to someone else or prepare food. So we also talk about what their likelihood of passing it on to a large number of people would be. After that, we do report that to the state. But the state doesn't say, Jimmy Jones had salmonella to the CDC. And I know that that's a concern of people. We've talked with people who say, where does this go? The CDC just gets pure numbers. They say in Virginia this week, there were 60 cases of X disease. There were 3 cases of salmonella. That's all CDC gets from Virginia. They don't get personal information.
And then what happens after that? So you all are collecting the information, finding out where there are outbreaks. And again, going back to Lisa, you had mentioned the difference between outbreak versus pandemic versus, outbreak versus epidemic versus pandemic. You figure it out. You go, okay, oh my gosh, we have an outbreak of salmonella. Then it gets reported. Then what happens? How do people know that's even happening?
Exactly.
Right. And what's interesting is it depends on what's going on with your outbreak. So let's say you have an outbreak that occurs. I'm thinking back on an example I can give. If you have an event, a personal event, say a wedding or even a funeral or something like that, where you have a large amount of people who might be from all different places, who are all there at your event, and you have food served. And say your salmonella outbreak occurs after that, and everyone's gone home to their state. You might have a concentration of people where it actually occurred, but there's people who've come from out of town. And you realize, okay, this is associated with the meal that was served at this event. Then you do a trace back, and the state will help you with that, to trace back after you determined what the foods are and what's the most likely food that made them ill. And I'm really glossing over here. The CDC and the state can help you determine not only was it that food item, but where did that food item come from? And did it make other people still ill in other states? Or was it isolated to your event? And laboratory evidence lends to this too, because you have lab evidence where they can actually see if there's almost like a fingerprint DNA match to other people who have salmonella in other states. Did they have something that came from the same source, even though they weren't at this wedding? Because their salmonella is the exact same salmonella.
So that's kind of cool, because it's kind of, I'm a huge Law and Order freak. I should be on a quiz show for Law and Order. I would totally win. So you guys are the investigators. You get the fingerprints, and these viruses and these bacteria are just like us. They have DNA.
Exactly.
And we can trace back to who the culprit is.
Right. So, I think it's important to point out, in an outbreak, it's not just the epidemiologists and the nurses that are working on this. You have lab is heavily involved and heavily important. Finding out what is causing that illness is the primary thing we really want to do at the beginning. Not only that, but really find out how we can keep people from getting sick continuously, right?
And I think that's a really important point. Part of what our focus is to prevent the ongoing spread. So there are prevention measures that we give right from the very beginning. When we have our normal mantra in public health, which is wash your hands, cover your cough, stay home when you're ill, get your flu shot. That's our mantra. We get up in the morning thinking it, we go to bed at night saying it. And yet, for an infection, an outbreak, we're really looking at what's the potential source. If we know the route of transmission, we've got it covered in terms of what recommendations to make for reducing the spread. It is critical that we recognize that there's fear when there's an outbreak. Sometimes the fear is palpable. If people aren't quite sure of what's going on in a community, it's our job to alleviate some of that fear by saying, here's what we think it is, and then to give them a sense of control by giving them measures that they can do. Infection preventionists are critical in helping us convey that message.
Exactly, because a lot of the testing might happen at a hospital.
Right.
We're dependent upon not only our state lab, for example, for testing, but other practitioners who are working with us, and the hospitals are critical in that.
So, Hannah, at the beginning, you said don't panic.
Right. I still stick with that as long as we kind of keep in line with what Evelyn was just saying. I think, everyone has to do their part, and I don't think we can stress enough hand hygiene.
It's true.
Washing your hands at its most basic is such a great start. And I know that, when you walk into a restaurant, and, all the signs that every restaurant says employees must wash their hands before they go back to work. And this is kind of why. So that, when food prep is happening, or, whether they brought something into the restaurant or the food itself brought something in from the distributor, or from, I know, if there was a romaine lettuce outbreak, they can bring it right back to a certain region within California, or alfalfa sprouts or anything like that. But it was just, that hand hygiene component is really where it comes down to everyone can do it. Infection prevention is everybody's business. And, this kind of leads into, we want to know from each of you, what's the one thing that's bugging you that you want people to know that they can help kind of with the cause, if you will?
Well, certainly if you see something, say something, right? That doesn't have just to do with packages that might be suspicious. It really is if you are a patient in a healthcare facility, or even getting your annual examination at your doctor's office, you should be seeing hand washing going on. And in restaurants, we should see people not touching foods that aren't going to be prepared in any way. They shouldn't be touching it with their bare hands.
How about you, Lisa? What's bugging you?
I think if I had to say what's bugging me, or what I would say, what seems to stay on my mind again and again when we're working with different outbreaks or situations, is that I want the public to feel empowered that they do have some control over it and that they have a role in it. Because I think sometimes when there's a lot of fear, a lot of that fear is based on the fact that they feel like public health isn't doing enough, or I don't have any control over this and I don't know what's going on. But you know what? If you have some information about what's going on and there are recommendations, follow those recommendations. And if you know, hey, this is a respiratory illness, you know what? You can choose to stay away from larger crowds if that's what makes you feel comfortable. You can choose not to. You can choose to go to the mall and be among a lot of people. But I think there's a lot of self-protection measures that you can take that are really simple, and people tend to look for things that are really complex, when hand washing is a huge one. Hand washing is so simple, and that's a huge, it reduces the incidence of disease so much. Just that very basic soap and water friction for 20 seconds.
Absolutely.
And so for me, I think it's just empowering yourself to protect yourselves, and to just, as Evelyn said, see something, say something, be a part of that solution. Because you know what? When people call us and say, we were all together with a big group at a restaurant and all of us are sick now, and we think it might have been that because we don't have anything else in common and we have these symptoms. Well, no one else would have called us to tell us that.
That's
and we
right.
wouldn't know that there might have been a problem. So we really appreciate those notifications. And they're not from IPs or doctors necessarily.
So, Lisa, Evelyn, tell the folks listening where they can go to get the best information if they have a question or concern about an outbreak.
If you're concerned about an outbreak, certainly call local public health. They are readily available in every community.
Wherever you're located. And if you would like more information, I would definitely check out the Centers for Disease Control and Prevention website at www.cdc.gov.
Great.
Thanks for listening to the 5-second rule and doing your part to prevent infection, because remember, infection prevention is everybody's business. To hear more 5-second rule episodes and learn more about how you can help, go to apic.org/5-second rule.
The 5-Second Rule is produced by the Association for Professionals in Infection Control and Epidemiology staff, including Hannah Andrews, Ricky Dana, Christine Miller, and Sylvia Cavedo, in partnership with Human Factor. Audio tech is Blake Alphin.